Now, a lot of people don't realize when you're working with a very gentle touch and what it does. Let me explain. So now I'm still working with Claudia with her ACL and meniscus. I've got her foot on her ball, but I wanted to show you this. So now a lot of people think, whoops. All right, that'll work. So a lot of people think they see me working, right? And right now I'm just working, and if I ask you, do you even see my hands moving? You might say no. But I can ask you, do I see the ball moving? And you're going to say yes, because you can see just my minor touches here, how it reflects in the ball and her foot. Now, sports medicine. Everybody's working on the bat, the glove, the ball. What they don't realize, if you do not have optimal movements from here to here, right? So again, I golf. When people are surprised that I've only been golfing now, what, 4 months, 5, maybe going on 5 months, since October, I can clock a ball pretty straight, and people don't get it. I have crooked legs, I have flat feet. People don't get it. Because again, everybody wants the perfect feet, the perfect shoes. But what I have, you ever want to work on somebody, you work on my legs and feet. I'll show you what supple fit movement is. Because again, I could do movement lesson. So if you look at how subtle I'm touching her and how much movement is in this yellow ball. So if you're about to swing a bat, hit a ball, whatever, golf, and you don't think that why you're hitting off to the right, and you're trying to do it through your arms, your wrists, and all of this, but you're not working on all these little movements here without the foot. So again, if anybody has, let's say, contractions through here, right, you're not going to get the follow-through swing, right, because the foot needs to show a rotation. Now she doesn't have it yet because she just had ACL surgery. Now, does she golf? Yes, no. But when I work on her, I don't care if it's her getting out of the car, right? Or getting out of the golf cart or swinging the ball or whatever. It's not up to me to decide. I put movements into the system. So when and since they're functional, when she's ready for those movements, they just come out. Right? So sometimes right now, if you're working with your child and you don't think you're doing anything, and you're just doing this because Michelle told you to do it and to keep it that gentle, and you're not seeing it, right? Again, you're hardly seeing my hands move, right? But the ball's moving substantially, right? And so you don't necessarily have to work on the ball just to see the movement. I'm working on the ball for a couple of reasons. First of all, I don't want gravity to be too hard on the knee. So in other words, if the ball's not here, she's going to hang. And gravity, especially if you're newly wounded, cerebral palsy, genetics, and so forth, gravity's now going to pull the leg down. This now, again, we just did a live. You can see, again, the pendulum difference now between before and just a couple, half hour ago. But I don't want gravity to pull her down because she's fatigued or whatever, or because she's just had surgery. So here, I want her to work on her rotation more, so gravity is not as substantial on her system. And so that's one of the reasons why I was bringing out a ball. But again, that ball is moving way more than my hands because it's the trajectory of my movement. And so my trajectory of my movement, let's say for Claudia right now, is going into where, again, her foot were to go there, even though this is just my touch. That trajectory, even though I'm not getting her to do this, the ball is reflecting my movements, right? And this is just some of the things that you learn here, and it's very important to learn here, but you don't necessarily have to understand it, and that's okay. Thanks.